This is the recording for the occupational English test, and this test is held at Medcity International Academy, Kannur on Wednesday, 5th April. The candidate name is Sangeeta and the candidate number is 4679. The interlocutor is Sukumar Mesapogu and the interlocutor number is 7652. This is role play number 1 and this is for the profession of nursing. Good morning.
Good morning.
May I see your identification, please?
Yeah, sure. Here it is.
Thank you. Okay, Sangeeta. Thank you so much.
Thank you.
Yes. Okay, Sangeeta, remember that this is a test of your English language, not an assessment of your professional knowledge.
Okay.
So keep that in your mind and speak as you would naturally.
All right.
Is that okay with you?
Yes.
Yes. So, we'll move on to the warm-up section questions. And this is not assessed.
All right.
So, Sangeeta, tell me the qualities that you have possessed as a nurse.
Well, that's an interesting question because I think as a nurse is expected to have lots of different qualities.
Okay.
I might not have all of them, but one prominent quality that I think I'm good at is my communication skills.
Okay.
I'm really confident about speaking to people.
That's
and
good.
As a nurse, I'm sure I'll get an opportunity to interact with lots of different people.
That's good, Sangeeta. So for the second question is, if at all, if you want to give any advices to your upcoming nurses, what would you give to them?
Well, again, I would say one top tip would be to be acquainted with things that are happening. Like I find a lot of these upcoming nurses,
Okay.
they're more focused only on academics and they're not aware of things that are really happening around them in India, in different countries abroad. So they should be well aware of the situation. I think along with the academics that they're focusing on, they should also be aware of their field of practice, like nursing, the changes that are happening across the world.
That's good, Sangeeta. For the last question, do you have a role model?
Well, not one person in particular.
Okay.
I think I try and absorb good qualities from different people I meet every day. It could be maybe someone I see on the street, or it could be my parents, it could be my friends, my teachers, my colleagues. So I just pick up anything that I find interesting in them.
That's good, Sangeeta. That's the end of your warm-up section questions.
Okay.
Now let's move on to the role play card. So I'll be taking the part of the patient and you'll be taking the part of the professional nurse.
Okay.
The role play will last for 5 minutes and you will be given 3 minutes to prepare for the same time.
Okay.
The role play intends to get evidence of your ability to perform effective communication with the patients.
Okay.
So do you have any questions?
No, that's perfect.
That's good. So you will have 3 minutes to prepare for the role play. You can make notes on the role play card if you wish to do so.
Okay.
Here is the pencil, Sangeeta.
All right. Thank you.
And this will be your role play card.
Great.
So you can look at the card during the test, but you must return to me at the end.
Okay.
Okay, all right then?
Yes.
You can start your preparation time now.
Okay.
Okay, Sangeeta, that's the end of your preparation time.
Okay.
Now you can start your speaking.
All right. Good morning, Harshita.
Good morning.
I'm Sangeeta and I'm here to check on your progress.
Okay.
Last night you were brought in with severe abdominal pain. How are you feeling now?
Let me tell you the frankness. Last night I'm suffering from severe abdominal pain. I couldn't tolerate that.
Yes.
But now I'm feeling all right. But nurse, I want to share this information to you. Like, please don't disclose this information to my mom because she cannot tolerate it.
All right.
Like, I am 18 years old.
Yes,
I was
know
pregnant with my boyfriend's baby.
that. Right.
And I thought to run away from the family after coming to know that I am pregnant. But this morning, due to this abdominal pain, I'm here. So please help me out regarding this.
Well, yes, definitely, Harshita. I would first ask you to calm down and relax.
Okay.
I know exactly what things would be going on in your mind right now, but this is not
yes.
the time to make such drastic decisions. First, let's get to the bottom of this. I understand why you would not want to share this information with your mother, but probably I'm sure at the end of this discussion that we have now, you might feel much better at sharing this with your mother.
Yes, nurse, but I'm really scared.
Don't worry. See, I've just gone through the test results.
Okay.
And your mother actually brought you in and we've done this test. And the test shows that you have something called as the ectopic pregnancy. Have you ever heard of it?
No, nurse. Is that causes danger to me?
No, don't worry. Relax. Basically, ectopic pregnancy means the fertilized egg, which should normally be implanted in the uterus, gets implanted elsewhere. And that is the exact reason which is causing you so much of pain and stomach cramps.
Okay.
Yeah, but like you asked me, like, is it something dangerous? There are certain possible causes to this. Are you aware of any causes that could lead to
nurse,
this condition?
I'm an uneducated woman.
No, relax, Harshita.
Okay.
No problem. Let me explain to you how this could have happened.
Okay.
One possible reason is called as the pelvic inflammatory disease. That is nothing else but your reproductive organs, they become infected. The other condition is called as endometriosis, which is when the lining of your uterus becomes really thick.
Okay.
As in there's a tissue lining inside the uterus, there would also be a lining growing outside the uterus. And there is a third possibility, which is maybe your ovarian tube has some kind of damage or obstruction or a blockage that has happened.
Okay.
Now, we're not sure exactly which one of these causes has resulted in this condition, but one of these is a possible cause.
Nurse, when you're telling to me, I'm really frightened because, my baby might get harmed because of this.
Right. Now, that is the other possibility that I'd like to share with you. This condition is not dangerous at this moment. It can be treated and there are treatment options available. So
could you please tell me those treatments, because
sure,
I will follow the treatments options which you tell to me.
Definitely. One is a keyhole surgery. Okay, and there is another less invasive method that we can follow, which is an intramuscular injection or a medication given to you, and that will basically kill the eggs, the existing cells there.
So you'll do the treatment now itself?
We'll have to first discuss with your mother as well before we go ahead with the treatment.
Yes, nurse. Nurse, my only concern which I'm having is, please do not share this information to my mother. You solve it by yourself.
Yes, I can definitely. I'm here to help you out with this.
Okay.
Harshita, at this point, you would be the right person to talk to your mother about this. I will definitely help you in that as well.
Like, I am ashamed and I'm embarrassed to see my mother.
Yes, but what is done is done. Okay. Now your mother has every right to know what is happening to you. Now, she brought in you here with the abdominal cramps and she would want to know the reason behind it. Truth is something that cannot be hidden. So we'll need to open up about this. Let her know the truth. Maybe, Harshita, you're just being a little judgmental when you think your mother is not going to take it in the right way. I'm sure as a mother, when you share this to her, she would definitely understand you and she would be the right person to support you.
Yes, nurse, when you're telling to me, I feel emotionally strong.
Right.
Okay, Sangeeta, that's the end of your speaking time. Thank you.
Medcity International Academy. Trusted hands forever.